Although post-traumatic stress disorder is difficult to diagnose and treat, with assessment guidelines and through the identification of risk factors for specific demographics, PTSD can be managed, thus offering those with the condition a better quality of life while avoiding further health complications. PTSD is classified as an anxiety disorder which is the result of a traumatic event. Symptoms of PTSD can manifest in a variety of ways. Amnesia, thoughts of suicide, hallucinations, and flashbacks of the event may occur, causing the individual to withdraw from society. Risk factors include exposure to family violence, genetics, and epigenetics. Persons involved in military combat who are prisoners of war or served in combat zones are at a high risk of experiencing PTSD. PTSD is difficult to identify and hard to understand. The National Institute for Mental Health lists 3 key signs. 1. Re-experiencing symptoms such as flashbacks. 2. Avoidance symptoms, which can manifest themselves in gradual or even abrupt withdrawals from society or normal activities. 3. Hyperarousal, or being edgy or jumpy. Left untreated, PTSD can wreak further havoc on those who suffer from it. Patients with PTSD have a higher prevalence of diabetes, higher body mass index, and are more regularly diagnosed with heart disease and osteoarthritis. 2 essential services that assist with combating PTSD are the ability to accurately diagnose and investigate the condition, and to monitor the health of patients with the disorder. The target demographics are covered are males ages 20 to 30 in the military and located at Fort Bragg. As PTSD is a mental health problem incurred by people who have suffered a traumatic event, this demographic was selected due to the high risk factors involved. Fort Bragg documented 6 suicides and 25 domestic disputes in a 5-week span. As Fort Bragg is a warrior transition battalion, being able to identify and treat the soldiers at risk is a #1 priority. "21% of spousal abuse is attributed to veterans with combat exposure. Due to the risks involved, not only to soldiers but family members and society, the Department of Veteran Affairs has employed a variety of methods to identify, track, and treat military veterans with PTSD. Society has come a long way in the assessment of PTSD and developing policies to address it. In areas where natural disasters are the cause of many PTSD cases, employers have worked to train managers to identify signs of the disorder as well as provide group or individual counseling to employees. For soldiers experiencing PTSD, a variety of organizations are available to provide help. VA sponsors the National Center for PTSD as a means to inform, educate, and give counseling to those in need. Intrepid Fallen Heroes Fund is a great resource for those wounded or injured in service. In the Fort Bragg area, the IFHF and Fisher House Foundation are working to construct facilities for soldiers and their families to learn to cope with PTSD. The Fort Bragg installation is aware of the risks involved with post-traumatic stress disorder. They work to identify the condition early so that treatment can be implemented. By placing traumatized troops in familiar settings, patients are able to open up and begin the road to recovery. Policy discourages accusing soldiers of faking a problem. It also warns clinicians of the dangers involved in the use of anxiety medications to mask underlying issues. New policies for consideration should call attention to the conflicts that arise between VA regulations on those with disabilities and soldiers who also suffer from PTSD, so that the best services can be provided to those who qualify. One innovative method of therapy is through the use of virtual reality. Virtual reality teaches the individual that they can remove themselves from a situation that no longer applies to them. VA personnel, Intrepid Fallen Heroes Fund, Fisher House, and trained medical practitioners all function as an excellent support and advocates for those with post-traumatic stress disorder. The three essential services are information, education, and empowerment. Providing pertinent information to key demographics at risk can reduce severe PTSD onset and reduce the risk of suicide. Fort Bragg officials recognize that education is a powerful tool to help struggling soldiers and their families. Through information and education, soldiers are able to empower their lives and work towards becoming whole. Womack Hospital utilizes this three-part process to help soldiers regain control over their lives and mental health. An important component of health is the ability to mobilize community partnerships. Organizations and community members that volunteer their time play an important role in giving veterans an improved quality. Operation Reentry North Carolina is another local organization that provides a variety of resources for soldiers who are working to cope successfully with PTSD. Army Strong Community Center, located in North Carolina, assists those with post-traumatic stress disorder through suicide awareness, employment, and emergency services.